Hi, Mrs. V. We're just going to do a little quick review about taking a blood pressure and put out some key points here to follow. This past week in the lab, we've been working on blood pressure again and taking vital signs, and I just want to review some key points here. The picture is showing the blood pressure cuff and how it is placed on the upper arm of your patient. You can see the arrows over here. I'll use my laser to point that out so you can see it. That should be pointing down where you palpated the brachial artery, and the cuff should also be up high enough on the upper arm to expose the antecubital, which is the fold of the arm between the forearm and the upper arm. You want to make sure you palpate for that brachial artery. When you feel that, you place the cuff on and you have a clear area that you can push the diaphragm of the stethoscope over, so that when you are deflating the cuff, that you actually are able to hear the thump, 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 okay? And you want to give yourself enough space. You should never have your diaphragm or your stethoscope held in place by the blood pressure cuff. It should always be held by your hand. Then just a review too on what does your BP mean when your doctor takes your pressure. They actually have a top and a bottom number, the top number being the systolic blood pressure and the bottom is the diastolic. And they write it like a fraction, 120/80. This is showing millimeters of mercury, mmHg. The average blood pressure that has become a standard is 120/80. It doesn't mean that it is the perfect blood pressure. They just set standards and radians of exactly where you can call a go-to number, and 120 is a decent pressure to have. Your top number refers to the amount of pressure that's in your arteries during the contractions of the heart muscle, and that is when the heart is at work. So your systolic blood pressure, or your top number, is when your heart is actually at work, and the bottom number is your heart when your muscle is in between beats. It's called diastolic, and it is when the heart is actually at rest. So you have systolic, the heart at work, and diastolic for the heart at rest. Both numbers are important, and that determines your state of health. Numbers greater than the ideal range indicate that your heart's working too hard to pump the blood to the rest of the body. It is also putting you at risk for frequent heart events such as a heart attack, high blood pressure, cardiac damage, enlarged heart. When we were dissecting the heart in anatomy, if you notice the walls of the cardiac muscle itself, you have the left ventricle, which is thicker because it works harder. You don't want your heart muscle to work harder and develop and become thicker and larger like the muscles, say, in your forearms, your biceps, or your calves when you're a runner, if you lift weights. You want the heart to pump effectively, and you want it to be able to have enough blood pumped to circulate to the rest of the body. Now, high blood pressure that's left untreated, known as hypertension, can lead to many signs, symptoms, and damage. If your pressure is up and it's left untreated, say you have a blood pressure of like 180/120 and you're not doing anything about it, you could develop chest pain, you could develop shortness of breath, visual changes, because that high blood pressure in your veins, that actually can cause disturbances in the tiny little capillaries in your eyes and can cause vision changes. Symptoms of a stroke, such as paralysis or a loss of muscle control in the face or extremity. Blood in your urine, because yes, that high pressure in your little veins, arteries, and capsules, or arterioles and capillaries. You can also have dizziness and a headache. A headache is one of those signs that people discuss, saying, oh, I have a headache, my eyes are really bothering me today. That would be a pretty textbook signal that maybe you have high blood pressure and that you should have that checked. There are a lot of interventions that you can teach your patients when they have high blood pressure. You could teach them diet, exercise, perhaps getting an electronic blood pressure machine, but certainly seeking medical intervention if they're experiencing any kind of symptoms like this before damage does occur, okay? This over here, these are two videos. This is actually just a review. I did put both of them. One is done by, I think, a healthcare practitioner of some sort, and then there's a nurse that is actually going through how to take the blood pressure. Many of my cyber kids, I have not even met this year, but some of the kids, even my seniors, this is a good review for NOCTI on how to place the cuff, how to actually measure on the dial and the sphygmomanometer over here, and to make sure that your equipment is working effectively, how to palpate for the brachial artery, and how to actually judge which is the systolic and which is the diastolic reading, okay? So please watch these videos, please complete the quiz, and that's the end of today's lesson. Thank you.